Hi, I'm here with my lovely patient Danielle, and we're doing Botox today. I just want to point out a few of the places that we're going to be injecting and explain why we're doing it. So let's start out with the forehead. We want to be careful on Danielle's forehead because in the past, sometimes she's felt like her eyelids get a little bit heavy. For people who are starting to get hooded eyelids, you do want to be careful on the frontalis muscle because it is an elevating muscle, and when you relax it, you can't engage it as fully. However, there is this thing called the line of convergence on some people where when they raise up, this part of the forehead, the very top, kind of dips down. So if you put a little bit of tox there, you can get like a little bit of a lift. It's subtle. Down here, Danielle is bothered by these lines. We haven't done Botox in about a year down there. So we are gonna put a little bit of tox in this area. I usually don't wanna go that close to the brow, but we're just gonna do like the babiest of baby Botox there just to kind of smooth that line out a little bit. And what that means when we make the dose lighter, we are not going to see it lasting quite as long, but I think that's a good trade-off in this case to avoid making the lid feel heavy. Next, we are going to be doing the 11 lines. If you could please furrow your brow for me. So we're going to treat here, and that is going to prevent the 11 lines from forming. It's also going to open up the face and make the eyes look a little bit more open. And if you also close your eyes really tight, you can see her brow kind of dips down below the pencil. So we are going to do a little bit on the tail of the brow to give her a little lift. Next, I'm getting asked a lot, sorry, we're also doing the crows. Those are the places that we usually do Botox, but I've been getting asked a lot lately about lower face Botox. You're seeing it all over the place. It is great for some patients, but it's not necessarily appropriate for every patient. So one of the places that we inject is the DAO. It's the muscle that can cause RBF. And what I'm gonna do is have Danielle stick out her bottom lip and pout, toddler face. Okay, she does not have a hyperactive or overactive DAO muscle. If I were to inject there, she's probably not gonna see a whole lot of improvement. Some people though will see a lot of improvement from injecting that. The other thing is that people are asking a lot about, okay, how can I get Botox to define my jawline more? Some people, yes, if you have a really active platysma muscle, the platysma goes over the neck and then it inserts up here. For some people, if you inject them along the jawline, underneath the jawline, and the platysmal bands, you'll really see a significant lift. However, if you don't have an overactive platysma muscle, you're just not going to see that much improvement. So Danielle, please say E for me. Her muscles aren't that strong, whereas mine, you can see mine are stronger. So I would be somebody who's a better candidate. I have some patients with like really thick cords here that kind of pull down and contribute to this jowling. But I don't think that this is going to be the best use of Botox for Danielle. So we can take that and put it, do something else with it. We'll mosaic you and we'll do some soft wave. So yeah, I hope that this was educational.